The degeneration of intervertebral discs involves the loss of water from the nucleus pulposus, decreasing the protein content and altering the chemical structure. A complete herniation typically results in pressure of the nerve root exiting below the affected disc. The worst-case scenario involves the nuclear materials breaking away from the rest of the disc and becoming sequestrated. In intervertebral disc lesions, the patient typically describes an insidious onset, but the pain may be related to a single specific episode. This most often occurs at the L4, L5, and the L5-S1 levels. Upon inspection, the patient may be noted as having a slow, deliberate gait, and in the acute and subacute stages, a flattened lumbar spine. In lumbar disc degeneration, the posterolateral lesions are more common because of a strong posterior longitudinal ligament. These tend to be insidious, and the pain is located to the affected vertebra. Compression of the spinal nerve root leads to pain in the low back and buttocks, possibly radiating into the thigh, calf, heel, and foot. The mechanism is a repetitive loading of the intervertebral disc over time, such as twisting and holding a heavy object away from the body while lifting. History of lumbar spine trauma will predispose individuals to this degeneration. Inspection may reveal slow gait, flattened lumbar spine, and changes in position being guarded and painful. Palpation may reveal spasm of the musculature possible. Range of motion will be limited by pain in all directions. It will be determined by the examiner if motions in any one direction increases or decreases the symptoms. Motion that decreases symptoms is possibly useful in the treatment of the patient. Neurologically, we will do a lower quarter screen. Special tests may include the straight leg raise. The straight leg raise involves having the patient lie supine, passively raising the involved leg to the point of pain. When that pain is found, back off, dorsiflex the foot, and have the patient flex their neck. A well straight leg raise will be done on the well side. Same process, looking for pain that may also occur on that leg as well. You can also do femoral nerve tension tests to recreate that pain. The standard lumbar spine radiographs are reliable for making a definitive diagnosis of lumbar disc degeneration. What we have to remember is that all discs tend to begin degenerating by the 4th decade of life and may be concurrent findings with other spine pathologies.